Okay. Now, are there any known causes to lupus?
Well, it's really unknown, but for me, I did research on it, and mine became from hereditary. I found out my uncle has lupus. I found out an aunt also suffered from lupus. So, and my mother suffers from rheumatoid arthritis, which is like it's not lupus, but it's a form that can lead a person over into lupus, and it like
Oh,
mimics the same thing. So basically, for me, it's definitely hereditary. I was out of all these amazing family members, I was one of the ones that was picked for this journey. So yeah.
okay, okay. Now, is there a cure for lupus? Is there treatments or anything?
There's no cure. Absolutely, there's no cure for lupus. There are many medications out there they're using. For myself, I take one medication weekly. It's called Benlysta. Benlysta is you can get it pill form, you can get it injectable, or you can get it basically IV. When I first started receiving Benlysta, I had to go to the Simon Cancer Center here in Cleveland, Ohio, and I received a treatment every 4 weeks where they infused the IV, and I would sit there for over an hour or so to get the treatment. Now I'm to a point where I give myself an injection weekly, and you have to be on time. But if I would have like kidney involvement like Kim, I wouldn't be able to be on Benlysta. I'm just blessed that the way lupus, I've been able to deal with the lupus part of me, and we'll get to a lot of that later. But for me, I'm also on chemotherapy drugs, which I take a chemo pill twice a week. And what that does, it contains the lupus, and it stopped me from having to take, at this point, steroids. I didn't want to take the steroids. So me and my doctor came to the conclusion to put me on chemo. It's a chemo pill form. There's another drug that a lot of people heard on the news that they were spreading around about they were going to use it for the pandemic, and that's Plaquenil, hydrochloroquine. That was the first lupus drug that was approved by the FDA over 50 years ago. And that was the first lupus drug I was introduced to by my primary physician care at the time when I was diagnosed in 2011. So as of right now, they have more studies going, and I heard there was another new drug out there specifically for lupus. But there are so many ways that there's treatment, but there's definitely no cure. You want to add anything?
Yeah, so as far as Plaquenil, or they call it hydrochloroquine, that is one of the many pills that I take. So because I have kidney involvement, that means I'm unable to get certain medications because of what's going on with my kidneys. So not only I take that pill, I take Celsep, and I also take a pill that they give people that had kidney transplants. So just like they treat lupus with just about everything. They they treat lupus with just about everything, and that includes chemo medication. They use same things they give people that had kidney transplants, and that's just how they do it. But there, like she said, there's no cure.
Okay, okay. Now, may I ask, how long have you had lupus, or when did you find out that you had lupus?
I was diagnosed in 2008.
2008. Okay.
For myself, I was diagnosed in 2011. However, as me and my mother brainstormed over the years as me being a child, we both came to the conclusion that I probably been suffering from lupus even as a child because the hospital doesn't exist here anymore, but it was called Mount Sinai Medical Center. And I used to go to the clinic as a little girl every Thursday. And because they couldn't tell my mother what I was suffering from, I used to go through these treatments every Thursday. They would pull hair from the side of my head, put it in test jars, and they could not give her a diagnosis. They
Wow.
just kept telling her they didn't know what was wrong with me. But as time went and I became a teenager, it disappeared until I became a mother during childbirth, and I became ill, and I was a teen mom. So, but then they also couldn't tell me what it was. So then the symptoms disappeared again until I was in my mid 20s, and I began to get sick again. But once again, I was tested for so many different things. Other than lupus, they've been testing me for cancer back then. And they thought I had a form of cancer, and they took me through a year trial of testing. It came out that there was no cancer. They just could not figure it out. However, in 2010, I changed doctors, and my doctor, I always shout her out because she's wonderful. Her name is Dr. Sharika Davis Pulley. She's my primary physician care. And I was describing to her over the years what I've been going through. And she was like, hey, wait a minute. Let's take some tests. She called me back in a week and she said, oh, you're definitely need to start this medication immediately. I'm sending it over to your pharmacist. You have lupus. But don't worry about it because I know what to do for this. And once I started the medication, it took 6 months before the medication kicked in, and that's the
Mm,
hydrochloroquine, aka Plaquenil. Before then, my hands were so bad that I was dropping and breaking everything because I did not have no feeling in my fingertips. Later on, even with that diagnosis, I found out I had neuropathy. And neuropathy, no, I'm not diabetic, but the neuropathy is induced due to the lupus. It's one other thing that I suffer from. So because I am diagnosed with symptomatic enuresis lupus, I've also gained other illnesses that's piggybacking off the lupus, and that's fibromyalgia. I have chronic pain disorder. I also have this anxiety thing, basically that appeared that I didn't suffer from before, and a lot of depression, and definitely I suffer from fibromyalgia, and I have episodes where I have brain fogs. So as the lupus progressed, it's different parts of my body that the lupus is basically degrading, like my brain activity sometimes. I have to step back from things and recalculate because I'm not thinking as fast as I used to and I realize it, or I become confused at sometimes. So basically, it's doing what it wants to do, but I continue to fight.